NHS 111, Linda speaking. How can I help?
Querying it.
Okay.
The full story.
What we'll do then, we'll take some details and then we can work out the best way to help you for today. So what's your date?
The Trust decided to move to NHS Pathways because it was a more integrated healthcare model than our previous provider, which predominantly dealt with 999 ambulance dispatches. What we were looking for is a greater integration of other healthcare professionals to get to the right patient at the right time to the right place. From a performance perspective, it has seen a reduction in transferable rates from the see and treat and hear and treat actually to delivery at the A&E department. So we were looking for a reduction in that area, and NHS Pathways has brought that about. There's obviously financial benefit. As in today's climate, we always look towards the finances, but also the most important benefit was we were concerned about a number of patients pitching up at A&E with inappropriate illnesses and ailments that didn't need to come in through the A&E doors. There's a logistical issue for us getting them to there and back from there, but also it was inappropriate for them to sit in A&E departments when really they should be sorted out in their local community by doctors, dentists, pharmacists, whoever.
Well, I think we had excellent engagement from the ambulance department. I think that's essential actually for successful projects such as this. You need to have everyone's buy-in. The Pathways team themselves were very supportive and very responsive as well. When we needed the answer to a question, they came back very quickly. Also, Adastra and Valencia, our ambulance CAD suppliers, spoke well together and liaised well together. So I think that all-round involvement was successful.
From an operational perspective, the new system as a whole has reduced possibly some resources from having to attend 999 calls and divert them to local A&E departments as well as the local surgeries where needed. And likewise from the Pathways side, we've had a lot of out-of-hours calls which have gone from out-of-hours to needing an ambulance, so it's more appropriate care for when it's needed. Now we're open up to GPs, nurses, district nursing teams, pharmacists, as well as all the regular stuff such as out-of-hours GPs and ambulances. So now, if somebody phoned up with a particular condition that needed a nurse, we can now arrange that and do all that through the hub in one central location, so everybody knows what's going on and what the best thing is for them.
Well, as district nurses, we come here each evening between 4 and 8:30, and at the weekends we're here on a shift basis between 8 a.m. and 8:30 p.m. Calls that come in through the 111 service, if there's anything nursing related, such as a catheter problem or a dressing that needs to be done, then that would be referred directly onto us, and we'll pass that through to a community nurse in that area. If a patient or carer rings directly through to us here, we can then speak to them on the phone about whatever problem they've got and see if a district nurse is needed to go out there and then, and we can organise that.
I'm one of the trainers here. We have 2 trainers. I went away to Exeter at the end of 2010 and I did the Train the Trainer course. My first involvement was actually coming back and actually getting all the staff here, both the non-clinicians and the clinicians, trained in NHS Pathways, ready for the go live. It's been very effective. The staff have thoroughly enjoyed the training. It's really enhanced the job role for the call handlers and for the clinicians. We all work together now more as one cohesive unit for the assessment and the direction of patient for the most appropriate service for their health needs.
Well, although it's early days, because 111 only started on the Isle of Wight 6 months ago, and we will be holding a full benefits realisation exercise in April, it is worth noting now that already the Isle of Wight ambulance has one of the best rates for hear and treat and see and treat in the country. And also, in addition, over the past few months, we've seen a change in the type of patients that are coming into the local hospital. This is beginning to show us that patients who are coming into the hospital are less sick, and it's enabled us to identify the types of patients we need to target to develop our services further in the community.